Time once again for an exciting program sponsored by the Smile Studio. Dr. Mal Braverman will be answering your questions on all phases of cosmetic and reconstructive dentistry.
Hi, everybody, and Dr. Mal Braverman will be with you momentarily, and I'm Bill Monahan. Have you ever wished you had a movie star smile? Seriously. Well, you don't have to be a model or an actor to look like one, you know. Dr. Braverman is one of the leading cosmetic dentists in New York City. Now, Dr. Braverman has created winning smiles for New York models, TV, and movie personalities. He's also co-founder and president-elect of the New York chapter of the American Academy of Cosmetic Dentistry. Dr. Braverman organizes professional meetings for other dentists interested in the latest techniques in cosmetic dentistry. Dr. Braverman will answer your questions on all phases of cosmetic and reconstructive dentistry. If you're not happy with your smile and have spaces, chipped, crooked, or discolored teeth, well, you may be interested in porcelain laminate veneers. That's right. A smile makeover in just, are you ready for this, 2 simple visits. An impression is taken at the first visit. Porcelain covers are made for your front teeth, correcting all imperfections, and bonded on the second visit. In 1 week, you have a perfect smile. You can also whiten discolored teeth at home while you sleep in just 1 week. So without further ado, here he is, everybody. Dr. Mal Braverman with the Smile Studio. Good evening, Dr. Braverman.
Hi, Bill.
Hi,
New York, New Jersey, Connecticut. Thanks for listening. If you have questions and have anything on your mind about dentistry, if you've been to a dentist recently and you'd like a second opinion or a free consultation, just give us a call.
Right. We've had some people that called up in the last couple of weeks that have had problems with other dentists. Not to say that every dentist is a bad dentist, but sometimes, just like a mechanic for a car, they just don't do a good job. Have you incurred some people in your office with people with bad teeth or a bad dental job?
Well, I think dentistry in general is really pretty good. People have a very high rating and confidence level in their dentists. It's actually, as professionals, number 2 behind pharmacists of all people. But that's sort of a third-party pharmacist. Mm-hmm. So as professionals, for dentists to come in number 2 in esteem is a pretty high number. However, dentistry is very difficult to do perfectly. And dentistry is either perfect or it's no good.
Right.
Because if you make a restoration, it has to be fit perfectly and seal perfectly. Otherwise, bacteria invade the tooth and decay it, and it's absolutely no good. So dentistry is perfect or it's no good.
Right.
There's really no in between. And that's always a challenge for a percentage of people.
If it looks bad, is it necessarily a bad job?
Well, that's a great question. You know, if it looks good, it generally is good. If it looks bad, it probably is bad because somebody hasn't really taken the time to make it look good, may not have taken the time to make sure it fits.
Right.
But if it looks good, that's not always a good indicator because it might mean you have a very good laboratory facility making crowns, but the dentist's end may not be so hot. So if it looks good, not necessarily. If it looks good, maybe. If it looks bad, probably not good.
Right.
In fact, I was just thinking about that. Most of the people who actually have come to our office as a result of this show, the kind of work that they've pursued is for a more cosmetic and a beautiful smile.
Right.
However, they all, at the moment, had dentistry that was not good. They had crowns in the front teeth that not only didn't look good, but they had openings at the margins where the tooth or the crown or cap or veneer fits. If that's open and it's decaying underneath, it's functionally not good, as well as aesthetically not good. And that happens to be the case. So it's interesting. Maybe there are a lot of people out there that are not particularly happy with the work that they have. They might want to
get a second opinion. Right.
Or maybe call and ask a question here tonight. Or, maybe come for a free consultation.
Terrific. Let's go to the phones. Let's talk with Aviva here in Manhattan, and then we'll go to Lori. How you doing, Aviva? Welcome to Smile Studio with Dr. Braverman.
Thank you. Dr. Braverman?
Yes, hi.
Hi. I'm now in my mid-50s. When I was 10 years old, I fell down and cracked my tooth. It's still cracked. It's still in my mouth. It's turned darkish because the root died and normally died. No root. I didn't have any root canal or anything like that. And I've been told that if I have just that tooth bonded, it's going to feel very funny. and I'm not going to like it by a dentist. My question to you is, what can I do to make just that tooth the color of my other teeth?
Well, I think it must be your idea then to have it bonded or veneered to make it the color of the rest of your teeth, and the dentist is saying you won't be happy with that solution. Is that what I'm hearing you say? Yes?
That I want to have it done.
Yeah.
It's not just me. People near to me have been conscious of it too.
All right, let me answer that question for you. Aesthetically, you could definitely make that tooth the same color as the rest of your teeth with a porcelain laminate veneer. And you know, we've talked about that. If you listened to the show before, you know what that is. And
I never have listened to it.
Oh, okay. You actually prepare the tooth, you remove a little bit the top surface of the tooth, take an impression, and you make up a porcelain cover that fits right over that tooth in the same color as the rest of your teeth, and you bond that porcelain on. It's very strong, it's very aesthetic, and it would take care of the problem as you see it. However, your problem may go functionally. That would be the aesthetic end. Functionally, you may have a bigger problem. If you fell and you broke that tooth, or you hit that tooth and traumatized it, what happened was the nerve from the trauma of falling died. The nerve has nerve supply and blood supply to the tooth. And the blood supply is hematogenous. That means that it has chroma in it. It has color in it. You know how blood is red. Well, when it dies, that blood becomes brown, and when it transmits through the tooth as black, ultimately, and then the tooth looks dark because that chroma, that pigment, is trapped in the tooth. Also, when that nerve dies, it causes pus in the tooth, which goes up to the tip of the root and causes you a little infection or an abscess at the tip of the root. And why you do root canal treatment, all that involves, it's not a big deal. It sounds scary, but it's not. You just make a little hole in the back of the tooth, you clean out the nerve, you clean out that focus of infection, and then you fill it with an inert material, a rubber-type material, and the infection at the tip of the root goes away, and you have a functional tooth. At the same time, you can bleach that tooth from the inside and take all that pigment away, and your tooth would get lightened naturally that way, and you might not need the porcelain veneer. So your options are to do the root canal and to bleach the tooth internally, or this sometimes happens, since this happened to you at a very young age and you're in your mid-50s, sometimes the canal of the tooth scleroses or closes up and hardens, and you don't have pathology at the tip of the root. And if you took an x-ray and you found out that you did not have pathology there, you could just take care of the aesthetic end of it and do a porcelain veneer or bonding. Does that answer your question?
Cost-wise, which would be more expensive? Is there a big differential between them?
Well, I would want you to take an x-ray and determine whether you had a functional problem. Then I wouldn't want you to see you spend the money on just an aesthetic improvement. I would do the root canal and the bleaching. That would be the preferred treatment. You would choose your treatment based on which was right for you, and I think the costs for each would be about comparable to do the best job. If you wanted just a quick fix, it would be less expensive just to put a little bonding material on that tooth on the front and change the color. That would be less expensive.
Now, to compound things, now that you've brought up a root dying later on or getting infected later on,
right?
Behind that tooth, okay, and up sort of in the back of my gum, the back of the tooth going up, there's been sort of an infection that I just got during the last 2 weeks.
That tooth that we're talking about?
Yeah. It has not been painful.
Okay, then you need the root canal. And you're getting that infection now. That's starting to show in the soft tissue surrounding that tooth in your mouth. So you've answered the question of what you need to do. You need to see a root canal specialist or someone who does root canal and have that tooth treated. And you'll see a change in the color. And if you come to someone who does cosmetic work, you can actually bleach the tooth internally and get that color back to normal.
Okay.
We could do that for you.
Excellent.
Yeah. Thanks for calling.
Thank you very much, Viva. Our number, by the way, is 212-688-3838 if you'd like to make an appointment. Welcome to Smile Studio with Dr. Mal Braverman. You have a question for him?
Yes, thank you. I have a rather small bump on my lip, and I'm a little concerned about it. My dentist tells me not to worry, but everybody worries about possible cancer. Is this something that should be biopsied or looked at?
Who told you not to worry about it?
My dentist said don't worry. He doesn't think it's anything.
then I would say that there's a possibility that's the case. If you're really concerned, the best thing to do would be to consult an oral surgeon, make an appointment, let him take a look at it, and let him decide whether he thinks you should biopsy it or not. That's what I would recommend, Lori.
Okay, thank you.
You're welcome. Thanks for calling.
We'll be back with more of Smile Studio with Dr. Mal Braverman and your questions. We'll be back with you momentarily. More with the Smile Studio and Dr. Mal Braverman. Don't go away. We'll be back.
Smile. Now there are 2 ways to effectively brighten your smile thanks to the Smile Studio. The first way uses porcelain laminate veneers, perfect for crooked, chipped, or spaced teeth. The procedure costs less than capping, and the teeth won't wear, stain, or discolor the way bonded teeth can. Plus, there are no needles, so it's pain-free. Want more information and a free consultation? Call the Smile Studio at 212-688-3838. There's also a customized do-it-yourself home bleaching kit, a special process that brightens your natural teeth. Bleaching gel can noticeably whiten your teeth in just a few weeks. Find out more. Call Dr. Mal Braverman and the folks at the Smile Studio for your free consultation at 212-688-3838. The Smile Studio is conveniently located in Midtown Manhattan in penthouse offices at 30 Central Park South. So now there are 2 ways to brighten your smile. Find out how by dialing 212-688-3838. That's 212-688-3838.
Welcome back, everybody, to Smile Studio with Dr. Mal Braverman, and we're taking your calls. Do you have anything else, Dr. Braverman, before we go back to the calls?
Well, I think people should be aware, if they're not happy with some crowns in the anterior part of their teeth, this may really be sort of the old-fashioned way, which is porcelain to metal crowns. That's when you have that dark line at the gum line.
Right.
And you can see that crown is not looking so good, or the color of it is very opaque or very flat. The new techniques that we have today in cosmetic dentistry involve all porcelain crowns that have gained their strength from being bonded, and they're very natural looking. Mm-hmm. They look like real teeth, and they can be very white and bright and youthful, and you can certainly restore a smile, your ego, your youth, by replacing dentistry that is not doing it for you anymore, like that dark black line at the gum line. So if you have that problem, you might want to think about all porcelain crowns. Also, those black silver fillings. We do nice porcelain inlays today in cosmetic dentistry, and it's not just healthier for you because there is a question about mercury in amalgam fillings, but they look great too.
Yeah.
So we got a bunch of calls.
All right, let's go to Herman over in Brooklyn. Herman, welcome to the Smile Studio with Dr. Braverman.
Yes, I'd like to know. I have partials, lower and upper. The lower are passable, but the upper, I constantly have to take them out. I'm not comfortable. I can't stay a whole day with them. It becomes annoying, and I eat better without them than with them, but I don't want my teeth to shift, so I wear them.
Well, Herman, you're right. I mean, if you don't wear them, teeth will shift, so that's a good thing. But obviously, they're not fitting you as well as they should. And how old are they?
May was a year.
Just a year?
It's about a year and a half.
Oh, that's not good. It depends. I shouldn't say that. It depends how many teeth do you have left up top that they're holding on to this partial?
On top?
Yeah.
I have about 5, 6 at least.
Mm-hmm. Well, it's possible if they're in good places to make you a very well-retained partial denture. But today, you know, if you're interested in something really good and you just don't have enough teeth to do fixed bridge work, which is not removable, that's when you have a cap and then a dummy tooth and another cap connecting the dummy tooth.
If I make non-removable, it'll loosen the other teeth, that the other teeth aren't strong enough for a bridge.
If that's the case, you might want to think about the periodontist as a specialist who takes care of the gums and the bone support of the teeth. And very often they can make your teeth healthy enough and strong enough to be used as abutments for fixed bridge work. And if you don't have enough strength from that, there is today implants. And you know what they are. An implant is basically, it's not very difficult. You make a hole in the bone and you implant, it's sort of just like screwing in a titanium fixture, which then can heal, and the bone heals through this fixture, and you have a new artificial root that is stronger than any root you were born with. And you can put a crown into that tooth, and you can have a very strong abutment for fixed bridge work. So if you're really unhappy with partial dentures, and you want to have something permanent, not removable, that will restore your teeth implants are the answer.
Do infections ever occur in implants?
Implants are very good today.
That's a good
Do
question.
you do this type of work?
Yes, we do.
I can come to you for consultation about this problem?
Absolutely, at no charge, Herman.
Very good.
You just mentioned that you talked to me on the show.
Very good.
Okay.
Thank you very much.
You're welcome.
Okay. Thank you, Herman. That number, by the way, is 212-688-3838, all right? Let's go to Juanita here in Manhattan and see how we can help her out on Smile Studio with Dr. Mal Braverman. Hi, Juanita.
Hi.
Hi, Juanita. What's on your mind?
Well, I'm mainly concerned about the mercury. I don't have that many teeth left, but then it does have mercury in it, and I wanted to know, would I have to go to like a holistic dentist in order to, because I don't want mercury in my mouth and I don't want to be put back in my mouth, but I do need to be fixed?
Well, you know, today, any modern dentist is a holistic dentist because the materials have gotten so good that we don't really use amalgam very much anymore. The reason for that is that the composite resin materials have now got a wear capacity that is equivalent to the old silver fillings. And they have some benefits over silver fillings. And they are not just that they look better, which they do. They're tooth colored. They look better. They have no mercury in them, which is definitely a positive or a plus. And they bond to tooth structure. Now, that's the biggie. Because when you put that in, the walls, you clean out a tooth of decay or silver filling, the walls can be thin, and the composite resin actually bonds to both walls and to itself and gives greater strength to the tooth in that way. And we have porcelain veneers, we have porcelain inlays, porcelain fillings that do that. So a good cosmetic dentist today is a holistic dentist. Okay?
Yes.
So you don't have to go to a holistic dentist. You can go to a good, modern cosmetic dentist. And thanks for the call.
Thank you.
You're very welcome.
Bye-bye now. Hi, Ray. Welcome to Smile Studio with Dr. Mal Braverman.
Hi, Doc. How are you?
Oh, I'm good tonight. How are you, Ray?
Okay, I have a question. I have full upper and lower plates,
Yes.
and I thought about implants.
Right.
Now, my dentist, I haven't been able to do that because that's a lot of money, and I'm sort of like, kind of saving up for it.
Well, there's two different ways to do that. Money is one of those barriers that can be approached. If you really want something, you can have it. You don't necessarily have to put implants for all the teeth. If you want to make an upper denture or a lower denture, I know your lower is the worst one, isn't it?
Yes, absolutely.
Yeah. You can put 2 implants on the lower, and then you connect a bar to those 2 implants, and you can have your lower denture have what we call a clip bar. And it clips right into the bar in the 2 implants, and it stabilizes it, and it makes it very solid. You would love it after having a normal, conventional denture. And it doesn't have to be that expensive. You can have 2 implant fixtures placed. It's an investment. If you can get credit, I'm sure, in an office and pay that out over a year, you might consider it. Wouldn't that be true?
That's true. And it takes about a year before the whole process is finished anyway, right?
It takes about 6 months for healing. And that's true, and you could do that in our office, for instance. A lot of dentists do that now. You can apply for credit, and then you can pay it out on terms. And so that's really a great investment. What's better than having some sound, stable teeth to chew with? Nobody knows better than you, right?
Yeah, absolutely. I have another question also. From what I understand, there's a factor called the erosion of your bones. The longer you wait or something like that.
That's true, especially with dentures.
How long does that take? What is the loss of bone?
How old are you?
Yeah, I'm 56.
How long have you been wearing dentures?
About 4 years, maybe.
Okay, well, I think that you could still be a very good candidate for implants, and you should come for a consultation.
Okay, that number, by the way, is 688-3838, 212-688-3838. Let's quickly, Kathy, do you have a quick question for Dr. Mal Braverman tonight?
I don't know how quick it is.
Okay.
That's
I
okay.
have virtually a phobia of dentists,
Uh-huh.
which means I haven't gone.
Yep,
And
you're not alone,
I haven't
Kathy.
gone since I was 15.
Oh, my. Well,
I know I have lots of problems with my teeth, but I don't even know what to tell a dentist.
okay, well, let me tell you this. First of all, you've taken a step just by making this phone call. You're dealing with your phobia because you're trying to do so. Of course, it's quite safe because I'm pretty far away and I can't touch you,
Right.
But quite frankly, most of our phobias come from being children. And you say you haven't been to a dentist since you're 15. Just like a computer, your mind is imprinted with fears and anxieties of a child. You're no longer a child, but they're still there. Until you change that computer program, until you take a step, and make them small steps. Come for consultation, have some x-rays, an examination, find out what you need. Doesn't mean you're going to do it. You know, it doesn't hurt to find out what you need. And then you may just find out that the adult in you will begin to start making the decisions and recognize that this danger is not as rational and real as you think. And slowly, with a little input from getting some confidence from the practitioner, I think you could turn this thing around. Remember, dental problems only get worse. They don't get better. So every time you come and you take care of something, you're stopping something from getting worse. Your fears may be realized the longer you stay away. And when you take these steps to reverse it, your fears will be allayed. So I'd encourage you to take those first steps.
Very well put. Tune in next week. I don't know where the time goes, everybody. Take advantage of a free consultation at his penthouse office. It's located at 30 Central Park South by calling 212-688-3838. That's 212-688-3838. Dr. Mal Braverman at Smile Studio.
Yeah, thanks for listening. Thanks for calling.
For questions about the show, you may call the Smile Studio at 212-688-3838.